This chart illustrates a hidden reality of women's health. Up to 75% of women experience pain during sex at some point in their lives, with a sharp spike occurring during the postpartum period. Medical professionals refer to this as dyspareunia. Because it is rarely discussed openly, many patients internalize the pain and accept it as a permanent condition. It is not. It is a highly treatable medical issue. Today, we are going to build your personalized action and advocacy plan. Together, we will map out your physical symptoms, script your conversations with doctors, and assemble an at-home toolkit for immediate relief. To do this properly, grab a notebook and a pen, or open a blank note on your phone. Find a quiet space where you can focus without interruption. Taking these exact notes gives you a distinct advantage. Moving away from silent endurance and putting a structured plan on paper is the necessary first step to reclaiming control over your physical comfort. Step 1. Write down your first heading, My Symptoms. Under this, quickly list exactly where you feel the pain, when it happens, and any specific physical actions that make it worse. To give your doctor the right information, we apply specific medical terms. Looking at this diagram, superficial dyspareunia is pain at the vaginal entrance. Conversely, deep dyspareunia is pain felt deeper inside the pelvis during penetration. Write down which matches your experience. You should also note if you suspect vaginismus. This is an involuntary tightening or spasming of the pelvic floor muscles that makes penetration either highly painful or physically impossible. If you have recently had a child, add a line noting your current breastfeeding status. This flowchart maps out exactly why that matters. The act of breastfeeding naturally suppresses your body's estrogen release. That drop in estrogen directly causes vaginal tissue to thin out and produces severe dryness, creating high friction and pain. Postpartum patients also need to log the specifics of their childbirth experience. Write down if you have scar tissue from tearing or if you pushed for an extended period, which severely strains the pelvic floor muscles. Translating your discomfort into this precise vocabulary removes the guesswork for your provider. It allows a doctor to immediately narrow down the underlying physical cause of your pain without making you undergo unnecessary repetitive questioning. Create your next heading, Questions for the Doctor. We are going to write down 4 essential inquiries for your appointment. We will build this list on screen. 1. Based on my symptoms, what is the underlying physical cause? 2. Are there lifestyle or hormonal changes I should make? 3. Am I a candidate for pelvic floor physical therapy? 4. Are further investigations needed? It is deeply normal to feel anxiety or embarrassment when bringing this topic up to a trained medical professional. Often, patients freeze and forget what they wanted to say. To bypass that anxiety, write down these 2 opening scripts. You can read them verbatim. Script 1. I am nervous to talk about this, but I am experiencing pain during sex and I need your help to fix it. Script 2. I've tracked my specific symptoms in my notes. Can I read them directly to you? Before you go to the clinic, you must also be prepared for medical red flags. If a provider dismisses your pain, tells you to have a glass of wine and just relax, or attempts to end the appointment without providing a structured management plan, the consultation has failed. Knowing these failure points protects you. Walking in with a written script guarantees that if a provider dismisses you, you do not have to argue. You simply pack up your notes, leave, and seek a second opinion from a specialist who will do their job. Let's build your final section. Title it Home Care Toolkit. Write down your first mandatory requirement, water-based lubricants. Underline water-based. Do not use oil-based lubricants. Oil degrades latex condoms, rendering them completely ineffective, and the chemical composition frequently worsens vaginal irritation. Keep it simple and stick strictly to water-based formulas. This diagram maps the fear-avoided cycle. When you expect sex to hurt, your brain produces anxiety, signaling your pelvic floor muscles to clench defensively. This tight tension guarantees penetration will cause severe pain, which only reinforces the anxiety for next time. To manually interrupt this cycle, log your next tool, diaphragmatic breathing. This is a mechanical fix. Taking a deep, slow inhale, expanding your belly, physically forces the pelvic floor muscles to drop and relax, immediately relieving that defensive tension. Finally, add vaginal dilators to your toolkit. These are graded medical devices designed to safely stretch postpartum scar tissue and gradually train your pelvic muscles to accept penetration without spasming. Medical intervention is absolutely necessary for long-term recovery, but assembling these specific tools gives you the immediate physical agency to safely interrupt the pain cycle in your own home, starting today. Take a moment to look down and review the notes you've just taken. You have mapped your physical triggers, drafted your required medical questions, prepared your opening conversation scripts, and outlined your at-home relief toolkit. Your final step is to pick up the phone, schedule an appointment with your doctor or a specialized pelvic floor physical therapist, and bring this exact list with you to the consultation. Painful sex is a treatable condition, and you no longer have to suffer through it in silence. You now possess the precise tools and vocabulary required to secure the right medical help, reclaim your physical comfort, and rebuild your sex life.